If I kept control of my calories and always followed a caloric goal, I wouldn't need any of this stuff. I would just do that. But we know how impossible that is for 99% of people. Same thing with this. If you cut a bigger dose of medication cold turkey, you're going to be met with more resistance. 48-hour fast every couple weeks, right? Lifting weights, optimizing stress and sleep, continuing to take your supplements. Some of you guys are going to require a little bit more effort than others. That's just the reality that you need to accept. I've been doing Colorado Medical Solutions for the past decade, and truth be told, my biggest passion is this right here, delivering the FLOA protocol, helping people achieve higher levels of health by hitting their weight loss goals and helping them wean off the medications, since the majority of people losing weight are utilizing semaglutide or tirzepatide, as they should, because it's so freaking powerful. And so it all centers around higher levels of health through the most important aspect of achieving lasting weight loss. And really, the end goal is that FLOA lifestyle group. So weaning off, I'm going to break this down into sections, but this is obviously a biggie, and this is obviously the most important thing, whether you're there now, getting close, or you're looking forward to it in the future. What does it actually look like to be able to wean off of the medications? Let's just start by talking about what is the difference between the FLOA protocol and the FLOA lifestyle, okay? So the FLOA protocol is what you do to accomplish your weight loss, right? The FLOA lifestyle is what you do to maintain your weight loss. That's it. That's the difference. FLOA protocol, losing weight. Lifestyle, maintaining weight. Now, if we zoom into the lifestyle, you're gonna have weekly or monthly ebbs and flows, of course. But the general idea is you should be staying within a 5 to 10 pound range for the rest of your life. And that's what I'm making a reality for you with the FLOA lifestyle. But to get to the point where you can live the FLOA lifestyle, you have to have completed the FLOA protocol for at least 2 to 4 months. You can't slip into the lifestyle without having accomplished the FLOA protocol. And that's important to understand, and what's going to help you understand that is getting a little bit into the science, which is my next topic. How does the FLOA protocol accomplish lasting weight loss, right? AKA, how does the FLOA protocol allow a person to live the FLOA lifestyle? Because what I'm presenting to you as the FLOA lifestyle is something that most people don't think is possible, and if they try it on their own, will be unsuccessful because they didn't do the FLOA protocol, all right? The FLOA protocol, which is a lot of things, it's not just one thing, but the classic, most important, most powerful piece of it is the fasting for 48 hours, basically a very long fast every single week. You know, the other pieces though is the lowering the carbohydrates and then cycling into a carb cycling lifestyle where you have some days off of carbs, resistance training, a supplement regimen that you stay consistent with, optimizing your stress, optimizing your sleep, addressing inflammatory issues, right? That's it. Those are the pieces of the FLOA protocol. But the fasting for 48 hours every single week, hands down, is the most important and most powerful piece for so many reasons, okay? So with this, you are making what I believe are the biggest improvements to your physiology, right? Those improvements specifically make a person more insulin sensitive, aka they reduce insulin resistance, they reduce inflammation, and they make a person more fat adapted, which is also synonymous with saying it improves metabolic flexibility, okay? When we think about obesity, and you guys know how I feel about obesity, it's a combination of genetic and lifestyle, which is what leads to obesity. I think it's 50-50. But when we look at it, and you guys also know, I don't think of obesity as something that's a switch that all of a sudden you don't have and then you do have when you hit obesity 30-35. That doesn't even make sense, right? I think this process, whether you want to call it obesity or not, we can call it weight loss maintenance difficulties, right? The moment you're 5, 10, 15 pounds overweight, there's a point where this issue, this disease, this condition, this weight loss resistance develops, and it gets worse and it gets worse and it gets worse. And the heavier you get, the worse it gets. Not impossible to come out of, but the harder it becomes to come out of. Diabetes is the same way, guys. The more diabetic you become, the harder it is to come out of, right? A lot of similarities between the progression of obesity and the progression of diabetes, but that's a separate conversation. We find as a person progresses with this disease, as they start gaining more weight, as they start getting deeper into the hole, they start developing a trend towards the worst direction of those three things that we just talked about. They become more resistant, insulin resistant. They start increasing inflammation levels, and they start losing fat adaptation. Okay, there's more to it, but I always talk about those three things because those are the three most important, and I find will really cover the majority of people, right? We got situational things that we can talk about outside of those three, but those are the big three. And so the FLOA protocol is the world's most aggressive, prolonged fasting regimen, right? I look forward to the future where we can actually have potentially some data. I love the results that I'm getting with you guys to be able to be contribute, at least spark some interest where they can actually take people into metabolic wards and maybe do some real studies. I hope that I can inspire that at some point before I retire. I would love that. But we don't have data looking at the FLOA protocol. We have plenty of literature out there that talks about, that looks at prolonged fasting and looks at the benefits, but a lot of what we're doing, a lot of where I base this off of is my observation over 10, 20 years between myself and patients, ancestral wisdom, but really looking at the mechanisms and the science that we do have on fasting, okay? And most importantly, just the success I've had with patients achieving lasting weight loss, of course. And then we fast forward with the progression and the availability of these GLP-1 medications. That was the key that made it so much easier, and boom, here we are. So, in summary, we are making massive improvements in your physiology. We are essentially getting to the root cause of the resistance towards weight loss maintenance, aka obesity. And it's the FLOA protocol, which is the summation of all these lifestyle changes that we're teaching you guys how to implement so that you can then get to the point where you can live the FLOA lifestyle. But if you are somebody who just took the medications, lost the weight, right? You're at your goal weight, but you didn't do the FLOA protocol to lose your weight, you're not going to have the same experience living the FLOA lifestyle that somebody else would have having hit their weight loss goal via the FLOA protocol. And so that's important to understand. And now you understand a little bit of the science of it. Weight loss does not necessarily just mean you're going to have improvements in all those three things. Now, weight loss, we can say you will have some improvement in those three things. I think it's impossible to lose weight without having some improvement. But we know for a fact, because the literature is actually very clear, 70% of people who stop these medications regain their weight back within a single year. So clearly losing weight is far from what needs to be done for these things to be successful long term. And I think the FLOA protocol is the best shot that anybody has at being able to achieve what I want for you guys, which again is living the FLOA lifestyle. And what do I mean by living the FLOA lifestyle? The lifestyle where maintaining weight for some of you is a reality for the first time ever, but it's easier, right? Because you've heard me talk about that. Sure, I could lose weight by restricting my calories, and then I can just keep a tight control of my calories for the rest of my life. I could do that. Theoretically, if I kept control of my calories and always followed a caloric goal, I wouldn't need any of this stuff. I would just do that. But we know how impossible that is for 99% of people. 99.9. So this is why I really emphasize doing the FLOA protocol, improving your hormones so that you can live the FLOA lifestyle. So that is the end of that topic regarding the science of why this works to be able to get you to there. Hitting your goal weight, aka entering the FLOA lifestyle, step by step. What does this look like? No, it's not black and white, okay? There's going to be variation and modification that I'm teaching you guys to learn how you can adapt towards your body and experiment and figure it out. I'm not giving anybody medical advice, and I will always throw that disclaimer because I gotta protect myself if I want to be around to be able to help you guys. But I am giving you the pieces that we can put together into a format that you may or may not have to slightly modify. So Number one, we just got to remember the mindset. Okay, so let's get a mindset that a frame of reference, if you will, because, and you've heard me talk about this, when you're on these medications, you are, especially near the end of your goal. Okay, when you're in the beginning of your journey with tirzepatide, semaglutide, you're just going from extreme food chatter to, oh my gosh, I can breathe, right? Oh my gosh, the food chatter is decreasing or it's completely gone and I can focus, I can breathe, my attention isn't so preoccupied, I can make better choices, right? And I use them as tools so that you can implement the FLOA protocol. But let's fast forward past that, right? Because we're talking about being near your goal, at your goal, entering the FLOA lifestyle. So you've been there, done that for 2, 4, 6, 8, maybe a year. Maybe you were one of my bigger goal patients and you had 150, 200 pounds, okay? So you've been on the medication for a very long time. And so remember the mindset. Your mind is no different than your muscles, than your metabolism. Anything that you expect to get stronger requires training. Anything that you stop training, right? Anything that you stop stressing, that you stop challenging gets weaker, okay? So even in the beginning, when you were failing to overcome your food chatter, which is why you started the medications, and again, you don't feel bad about failing to mindset yourself over the food chatter, right? That's why we call it a disease. If people could beat their food chatter without the meds, then we wouldn't be in the epidemic of obesity that we are. So don't feel bad about that. But in the beginning, no matter how hard you were training, I like to think of it as the gradient was too steep. You were trying to swing the bat in major leagues, but you didn't have the experience with T-ball and minor leagues and yada, yada, yada. If you're a baseball fan, which I'm not, but I like that analogy for this example. You took the medications, you shut off that food chatter, and now we can actually play ball. All right? AKA, we're out of the major leagues, we're in the minor leagues, or we're playing T-ball, and we're making contact, right? We're actually making contact. When you're actually making contact, you can get better, right? So again, that's why you needed that to make your progress forward. But now we are, again, however many months you were here, right, is dependent on how big your goal was or how long you have access to the meds. But 2, 4, 6, 8 months of continuing to lose weight, continuing to be on that medication, how do you continue to develop a stronger mindset? So we took you out of major league and put you into minor league to get better, and you kept playing minor league, you're going to stop getting better because you get accustomed to minor league, just like you were accustomed to the very, very first time you swung a bat. AKA, if you don't continue to progress, you don't continue to get better. In fact, the lack of progression can actually be looked at, and I look at it as a weakening. If you continue to stay in the minor leagues on the medications, your mindset of being able to experience hunger, experience minor food chatter, and eventually develop an ability to live with it and cope with it becomes decreased. So we have to understand that the training wheels are going to be off, right? You need to be able to deal with the major leagues, which is some amount of food chatter in your life. But now it's a reality. Now it's a possibility because the food chatter is made a lot less because food chatter is a symptom of obesity, and we talked about the science of obesity and all the things that we're doing to your physiology to improve it via the FLOA protocol. But we have to remember one big piece of it is just accepting that I'm going to now decrease the medication, and so get ready for some hunger, and everybody's case is going to be completely different. Some of you are going to have no problem. Some of you are going to have some resistance. Some of you are going to have level 3, level 4, level 5, if I was to quantify it over 5 levels. Like, you guys are going to have varying levels of difficulty with experiencing food chatter as you begin to turn down the dial, as you begin to decrease your medication. Now, again, disclaimer, I can't tell you, nor am I telling you to decrease your medication. That's a decision that you've made on your own via your practitioner who's prescribing you, whether it's our providers or whether it's someone else's, right? That's your decision. So if you are deciding to do that, step number 1, okay, is the mindset. Now, when you start to decrease the dial and you start to decrease the medication, like I said, either it's going to be a little difficult, medium difficult, or high difficult. Even if it is high difficult, that might be a situational thing, right? That high difficult for, let's say, the first week when you're off your med, or when you're on a half dose of what you were on before, right? That also might get better after another week or two, right? Because guess what? You turned down the support, which was synonymous with increasing the challenge. And guess what's going to happen when you increase the challenge? You're going to get stronger, guys. That's what you have to look forward to. So just because you turn down the dial, which increases the challenge to you mentally, and the first week seems, oh my gosh, that is so hard, it's not going to stay that hard forever. It may, right? And we'll talk about that, but it may not. You got to give it a little bit of time. You got to keep challenging yourself and see, as you respond to the challenge mentally, if it does start to get easier. And for a lot of you, it will. For some of you, it may not. And there's one golden rule here, guys. You don't need to freak out about the potential of you stopping the medication and then after 3 weeks saying, I have to get back on. Oh my gosh, this is unbearable. That's okay. In fact, I would rather tell you right now that will happen to a small percentage of you. Again, why? Because I don't know how good you followed my program, and I don't know how specifically challenged your body was. How obese, how insulin resistant, how inflamed, how genetically predisposed to obesity and regaining weight. There's so many variables that I'm not even going to focus on that per se for you. I'm just going to show you what to do if you are somebody in that category where it's more challenging, okay? So we developed the mindset of being prepared, being ready for that point, and accepting what comes along the way. So you may need to go back on the medication. It's okay. 1 or 2 rounds, 3 rounds. If you're off, great. Most of you won't have to do that. I'm just prepping some of you for that, telling you it's okay. So now, most of you decrease your medication. There's 2 ways to decrease your medication. You can cut it cold turkey, or you can slowly decrease. A lot of variables with that. Are you at the full maximum dose, 15 milligrams of tirzepatide, 2.4 of semaglutide? You probably shouldn't go straight to cold turkey. I'd probably at least go to half and then 0. But if you're like most of our patients and you were only at 5 milligrams of tirzepatide, right, maybe 1 of semaglutide, you could still go half, or you could just cut cold turkey. We're making a decision right now. You are making a decision of what I need to do as far as weaning off the medication. Just like the discussion about increasing your fasting way when you started in the beginning, same thing with this. If you cut a bigger dose of medication, cold turkey, you're going to be met with more resistance, right? Meaning a potential for your food chatter to come back on and just overwhelm you. So you need to make that choice. We talked about the mindset, and we talked about decreasing the aids. Now, the major aids are the peptides and the medications. GLP-1s, peptides like AOD, CJC. Now, CJC and AOD, you do not need to stop. If finances allow for it, you can absolutely keep those going for more results. But if finances do not allow you to keep going and you have to stop, then you stop both. So in that case, I would stop the AOD or the CJC first. You're continuing to fast for 48 hours every single week. You're giving yourself a week or 2 where you're off the AOD, you're off the CJC. Again, if you aren't planning on financially continuing it for a few more months, you keep the fasting going, you keep the GLP-1 going, you're looking at your weight because you're at your goal, right? Again, we're talking about weaning off and you're stable. Great. Next step. I'm just on the GLP-1. Now I want to wean off of that. So we talked about that. Do you go cold turkey? Do you week by week lower the dose? You have enough ammunition and knowledge to make that choice and discuss with your prescriber. Once you get to the point where you're off the med, you're still flow fasting. You are still fasting for 48 hours every single week. The reason being is because you want to think of it as a titration. You want to think of it as we're slowly starting to reduce the aids, but we don't want something so dramatic where we start gaining weight. I want you to continue to flow fast for 48 hours if that's what you're doing every single week, for at least 2 to 3 weeks when you're completely off the medications. Number one, I want you to see that you can actually do the fasting without the meds and the peptides. And number two, I just want to establish stability. And again, using your weekly weigh-ins, using pictures every 2 weeks. And we talk about pictures. You can have someone take a front, side, and back picture just to look at your body and see and engage how the body fat is looking visually. And once you've had 2 to 3 weeks of stability, you're off the medications, you're off the peptides, you feel good, you feel in control, you are experiencing hunger, right? You are experiencing some amount of food chatter, but you can control it because you've had 3 weeks now of developing a tougher mindset, and we talked about that earlier. Then you begin to decrease the fasting, okay? So the first stage of regression is 48 per week down to 48 every other week, right? So 48 every other week. Do that for a month or two. Same concept. How am I doing? Do I feel stable? How's my weight? Do I feel in control of it? Do I feel like I'm losing control? But take as much time there as you need to, again, establish stability. You can always go backwards, right? Meaning you can always progress your fasting back to every week if you feel like you're losing control. So 1 to 2 months fasting every other week, everything looks stable. Now we are officially ready to enter the FLOA lifestyle of fasting, right? So the FLOA lifestyle of fasting, I have found for most of you guys, is a 48-hour fast once every 2 to 4 weeks. A 48-hour fast once every 2 to 4 weeks, or maybe a 72-hour fast once every 3 to 6 weeks. You're going to have to vary that for so many reasons. Again, your genetics, your lifestyle, your stress levels, and how good are you doing on your diet? How good are you doing on your exercise? And truth be told, while you guys are going to have an individual spectrum of where you fall into how good or not, or how not good, there's also going to be the inevitable ebbs and flows of your life. And so I don't ever stay consistent every 4, every 3. No, it varies, right? If I have stressful months and I find myself slipping a little bit, I just increase. I go, okay. I take a step back and I go, let's turn it up. I can tell I gained a couple pounds. And I can just look at my body and see and go, okay, let's go back. Maybe I'll regress to every other week, or maybe I'll regress to every week just for 2 or 3 weeks. Like, you have such a powerful ability in the FLOA lifestyle to essentially just crank on your fasting and use that as the most powerful tool to maintain a healthy weight. Now, the other tenets that we taught you guys and implemented during the FLOA protocol are 100% still at play. You need to keep your intermittent fasting going. In fact, the intermittent fasting is more important in the FLOA lifestyle because you're not FLOA fasting every week, right? You're doing it every 2 to 4 weeks. And so your intermittent every other day is very important. Your approach towards carbohydrates, I recommend a carb cycling lifestyle. Now, some of you, if you came to us and you didn't have or start off with a high amount of obesity, a high amount of insulin resistance, probably can get away with having carbs every day. Because remember, the starting point of where you guys were at was completely different. High amount of obesity, high amount of insulin resistance. You are high amount of genetic-based obesity. You are always going to have a little bit of extra checks and balances for you. Somebody else starts off this program and they're just 20 pounds overweight, but they did the FLOA protocol because they want the most powerful program, right? This works for somebody barely overweight, extremely overweight and obese. But they're going to be able to, this group is going to be able to live a much easier FLOA lifestyle, and this group is going to have a little bit more checks and balances, but that's okay. So generally speaking, I deal with more of this population over here. So that's why I recommend a carb cycling lifestyle. And I have separate videos talking about that. But basically, eating carbs on the days that you lift weights, 3 to 4 days a week, and then going low carb on the days that you don't lift weights makes a huge difference. Resistance training, keeping that up for the rest of your life. Keeping up your supplement protocol for the rest of your life. Always prioritizing sleep and always optimizing stress levels if you have situations that turn on certain amounts of stress. Those are the tenets during the protocol, and those are the tenets after the protocol. So really, like I said in the beginning of this, It's just turning down the frequency of that long fast. That's really the big difference between protocol and lifestyle. But again, as I said earlier, you got to do the protocol to be able to live the lifestyle. So another important piece, as you are winding off the medications and or peptides, if you're winding off the peptides, you have other supplements that you can now lean on as a transition. There's so many options. First of all, the most powerful transition would be going from GLP to tesofensine. Tesofensine, we've talked about, is my backup as an initial tool. If you can't get qualified for a GLP-1, you can use tesofensine. If you didn't use tesofensine, you can now use it as a transition. This would be somebody who really wants the smoothest and easiest transition. That's the most powerful transition that I have. Outside of that, now that's like a peptide medication. Now you're leaning on supplements. You guys know I have that category of appetite suppressing supplements like Unimate, Cali Curb, the Balance, which kind of goes with the Unimate, and even nicotine gum if you're not a prior smoker. I have videos about those supplements, but you can start using those. We use those more situationally during the protocol. Now you can go back to using them every day for a couple weeks or a couple months to just help you with that transition, to just make it smoother, make it easier. Maybe you try to do it without the supplements. It's too hard. So you go back, work your way into it, and this time you try the supplements, right? There's so many ways to go about doing it. All right. So the second part of this is now we've talked about flow protocol versus the flow lifestyle. You understand it now. You understand the step-by-step process of weaning off. But I just want to summarize this. Living the flow lifestyle means that you are doing what it takes now to maintain your weight. And as I said earlier, 48-hour fast every couple weeks, right? Lifting weights, optimizing stress and sleep, continuing to take your supplements. Some of you guys are going to require a little bit more effort than others. That's just the reality that you need to accept because of the dramatic amount of variability that each of you guys experience. But if you just follow that program, if you're a person who had a lot of those issues, then maybe a 48-hour fast every 2 weeks. Maybe that's what you need, right? That's why I say every 2 to 4 weeks. You got to find your rhythm. You got to find your balance, but you just follow those aspects that we're talking about and you will be able to find a balance. If you guys found this video informative and you learned, then you're going to want to check out this following video that I linked. It's all about lasting weight loss. We'll see you there. When you're putting effort towards losing weight and the weight loss begins to slow down and then stop, AKA I'm eating less, I'm exercising more,